Neurosurgery is such a long training path. So, my advice really is to find something that you're passionate about that'll help you kind of see beyond the individual trees. I started reestablishing my connections with global neurosurgery mentors, and that really helped me establish my vision for what I wanted and helped me see beyond the day to day of residency. So, find what you're passionate about. Doesn't have to be global neurosurgery, it can be bench research, be some big idea that you have that you've been passionate about.
Great. I'm Dr. Lee, and I'm here with Dr. Maria Punchak, who is now in her last day here at Pennsylvania Hospital, the nation's first hospital. And what's exciting is I just want to talk about her career and her path to neurosurgery and her future goals. So let me turn it over to her.
Thanks, Dr. Lee. Thanks for having me. Like Dr. Lee said, I'm Maria Punchak. I have had a little bit of an untraditional path into neurosurgery, and we're going to talk about that today, as well as my research interests and just advice for people interested in neurosurgery.
Yeah, so most of us go to 4-year college, then we go to 4 years of med school. We just get into neurosurgery. Maybe you take a year off to do a little bit of research, but your pathway seems a little bit different. And
That's correct. So I went to undergrad at Georgetown University. I actually was born to begin in Russia originally, and then lived in Philadelphia, went to Georgetown, and it was really there during my undergrad studies in biology. I got interested in health economics and the study of provision of care kind of internationally. So before going to medical school, I knew I wanted some time to sort of explore those interests. I actually ended up doing a master's in public health at the London School of Hygiene and Tropical Medicine. And then as I was applying for medical school, I finished my medical school interviews in the US, and then I left for 7 months before going to medical school to work in remote Liberia in a very small, basically rural village called Konobo. So, um, Africa is obviously a really huge continent. So when you think of Africa, a lot of people just have this very um, like rural vision in their mind. But Africa can be many different things. But Konobo was very much that vision that everyone has, like no running water, no electricity. So it was definitely an interesting experience.
well, that is interesting because I do think of Georgetown as being, even though it's a very beautiful and upscale university, that it does have a global perspective because there are a lot of international students as well as, so that I do think that it makes sense how Georgetown can foster that. Do you think that was true of that experience?
Yeah, I mean, we have four different schools at Georgetown. There's the college, there's a business school, and then the two other schools that I think, are even more famous is there's a School of Nursing and International Health together. So that was the school where I took those classes in health economics that really inspired me to try to pursue this and see what it is out there, as well as the School of Foreign Service, which is a world-known, very famous school where all of the diplomats go that end up working in our nation's capital.
I see. So, but now I'm thinking about Liberia, your experience there, and neurosurgery. Did it? How much neurosurgical emergencies or did you see there? Like, what prompted you? Because this is before med school, before you chose neurosurgery.
There was zero access to neurosurgical care in Konobo. It's basically just had a district hospital, and there was not even a physician that worked there. There were some nurses that were able to provide care, and I was specifically working with a non-governmental organization, looking at establishing community health worker model in remote Liberia to provide primary care. So when I started medical school, I actually was not thinking about neurosurgery or surgery at all. I thought I would end up doing like pediatrics or emergency medicine, something that tied very easily into global health. But obviously, things changed.
But that is not an easy change because neurosurgery is so subspecialized and we rely on lots of technology. And I think that, so for example, MRI, it's like bread and butter. I mean, everybody gets an MRI before, everybody gets an MRI after. You can't even diagnose some of these problems without MRI. And yet, many of these countries, I think access to MRI is extremely rare.
So, Yes, that is correct. There's very little access to MRI, to even having a microscope during surgery, and then just any sort of advanced imaging or advanced techniques in the OR are very hard to come by. In medical school, once I realized I wanted to do neurosurgery, I took an additional year. Obviously, neurosurgery is very competitive for those of you interested in applying. And I tried to find an opportunity where I was able to explore those global health interests as they combined with neurosurgery. Luckily, actually, I think I picked up on this combination of things at the right time during the Lancet Commission on Global Surgery that came out, and there was sort of this global call to action in terms of improving access to global surgery and global neurosurgery. And I got to go do research in Uganda, looking at pediatric outcomes and pediatric TBI, and then looking at provision of care. So I saw, actually, to get back to your point, neurosurgery done in that remote setting first before having the experience of having access to all the advanced care. So I remember on my I knew that navigation existed, but I didn't really know.
Wow.
So I saw things done very differently, and I feel like that kind of painted my picture of what's possible.
Wow, that's fascinating. I just remember a story that one of our oncologists, who was the leader of the Davidson Cancer Center for a while, Chi Dang, and his father was a neurosurgeon. So he grew up in Vietnam, and he became a scientist ultimately. But his father was a neurosurgeon in the middle of Hanoi, and he told me that he had no interest in doing what his father did because his father literally would just come in for traumas, take out the epidural, take out the subdural, and then go. And that was really all he saw of neurosurgery in rural, or I mean, Hanoi is not rural, but
Yeah.
developing country neurosurgery. And what did you see that was different?
I saw, actually, in terms of different pathologies, there are a lot of congenital defects in pediatric patients. So, a lot of neural tube defects, some craniosynostosis, and then a lot of hydrocephalus. Those were the patients I was sort of attracted to, and I ended up doing a lot of research there. In terms of other main pathologies, there's a lot of trauma. Trauma is one of the biggest killers of individuals in low and middle income countries. So the provision of care is very little. Patients, there's also very little access to emergency transportation. So a lot of times I would be stationed in the emergency room. They call it accidents and emergencies there, A&E. And then you would just see like families drag their loved ones on the back of a truck or something and then just present them. That's how the patients mostly presented. And surprisingly, this was also very different to the US. A lot of the trauma that came in was actually epidural hematomas, not subdurals. And I thought that was really interesting, but it's because subdurals, they need access to care like much more quickly. So those people unfortunately end up dying.
Yeah, no, that is very interesting because epidurals are the most satisfying neurosurgical procedure because you can take a patient who looks dead and make them walk the next day, but you have to act really, really fast, and that access is limited. So, how do we? I guess we could talk about how to improve that education, one by one, teaching a neurosurgeon in a developing country how to do it. Is that where your heart is going? Or
So in my career, that's definitely something that I'm very passionate about. Um, I think the way forward, one, is really mentorship and education. There are a lot of very inspiring people, residents, even not in neurosurgery, in general surgery, medical students that I worked with internationally that are so driven and so motivated, and they just don't have access to the mentors in neurosurgery. So even working with one individual, I worked with several, but even like one individual, one on one, you can be very helpful in giving those people just the right tools or helping them get in touch with someone else. So that's definitely something. But that's on a smaller scale. On a larger scale, I would love to do. Carry out my own research partnership internationally and study provision of care for congenital anomalies internationally and looking at those things in more detail. I think there's a lot of patients that we don't even see really in the US anymore, just because of access to care here.
folate supplementation?
Exactly.
Yeah.
And really those international settings are, they have a lot more access to patients like that, and there's a lot of need there. So
Yeah. Huh. So that actually brings up an interesting point. So, primary prevention of a problem is perhaps the best way to make a global impact. So, examples being seatbelts, preventing the head injury rather than dealing with it afterwards, folate or vitamin Bs to prevent the myelomeningocele. And you could argue that if you want to make a biggest impact as a to prevent neurologic deficits or defects or congenital defects in particular, you really need to tackle it pre-part more. So,
mhm.
yeah, what are your thoughts?
I definitely agree. I think there's so much to be said for public health and preventative care, but there's definitely still a neurosurgeon's role in that in terms of doing advocacy. Neurosurgeons on the scale of individuals, people will listen to us, especially if you're an expert in the field. So there's multiple movements throughout the world, including something that I work with called GAPSPIF. It's basically an alliance to help the WHO improve universal folate supplementation. And it's really driven by neurosurgeons that partnered with public health professionals, with other individuals. So neurosurgery sees the end product of a lot of these conditions, but we still have a role in preventing them. It doesn't mean that we have to just like wash our hands of it and leave it to someone else. We kind of see things from start to finish, and we can be part of that process in terms of, improving access to folate or studying more additional, micronutrients that might be affecting, not folate dependent neural tube defects. So there's a lot to be done. There's a lot of advocacy work that's now very popular, and um, it's a very exciting time. I think even the national organizations, the WNS and the CNS, are advocating for this, and there's a growing movement of neurosurgeons throughout the world, and definitely in the U.S. that are very excited about this.
Yeah, it seems almost like every department or every big academic department perhaps should have somebody like you, somebody with a global interest. And I'm thinking about our department and who that is or who it isn't. And so that is interesting. I don't know, maybe you
It's
agree or
me.
yeah.
I'll take that role.
Yeah.
I'll be that person in our department. But I will say, I mean, there's so much interest, not just from the top individuals who are in charge of these, uh, you know, national groups, but especially from medical students and from new residents that match into programs. So since, I was probably halfway through residency and started really digging deep into research and reestablishing myself in this kind of setting. I've had so many medical students reach out to try to work in my lab. And I thought it was so funny. So I'm like, I don't have a lab yet. I definitely have research projects that I've gotten people involved with, but I agree. I think the movement for global neurosurgery is just going to keep growing. And if we can get more people from other countries even to like come here and work here, and we can have really a bi-directional exchange, that will be really powerful.
Yeah, that is I mean that makes a lot of sense to me that we every everyone should we should get more exposure among the students. And so where do you see yourself, I guess, in 5 years? So you have a 1 year fellowship,
Mhm.
and then you have to start your job. And actually, I still also think that in the first 3 to 5 years, you're still consolidating your skills. But then you got to start making that next move. And I'm just curious.
So I have a fellowship in pediatrics at Texas Children's Hospital. And then after that, I've been struggling with this decision for some time, but I have an additional fellowship that's really research focused at the Barrow Neurological Institute. So I'll be spending basically 9 months out of the second year post graduation in Tanzania, looking to establish research capacity and doing some clinical work as well. And it's really supposed to be an immersive experience to figure out, how to improve access to care and how to provide care in that setting. Because there's so much that you don't understand unless you practice in that setting. So that will be kind of a foundation of my research partnership. And I'm hoping to start multiple research projects and take that on with me once I start my job somewhere.
Well, I'm sure that many institutions will be fighting for you. So it's going to be very exciting. All right. So I thought we'd end with just advice you might have to students who are interested in neurosurgery, and even if it's not global neurosurgery, but
Yeah, definitely. Neurosurgery is such a long training path. I am coming to the end of my residency, which is 7 years, and I still have more time that I need to dedicate to getting additional skills. So, my advice really is to find something that you're passionate about that'll help you kind of see beyond that forest and the individual trees. First couple of years can be very intense of residency. So after my third year, which is when I finished my junior residency, I started reestablishing my connections with global neurosurgery mentors. And that really helped me establish my vision for what I wanted and helped me see beyond the day to day of residency. So find what you're passionate about. Doesn't have to be global neurosurgery, it can be bench research, be some big idea that you have that you've been passionate about. And keep that in the back of your mind because that's ultimately like the ultimate goal and what you're striving for.
wow, that's really fantastic because yes, it can be a struggle as a student or as a junior resident, but if you have a goal in mind, then you know where you're going. So very good.
Definitely.
Thank you, Maria.
Thank you, Dr.
All
Lee.
right.